What are the risks of having a child with CF? Cystic fibrosis is an inherited genetic condition caused by mutations in the cystic fibrosis transmembrane conductance regulator gene. The primary risk of having a child with cystic fibrosis arises when both parents are carriers of a mutation in this gene. In this situation, there is a 25% chance with each pregnancy that the child will inherit two mutated genes, one from each parent, and thus have cystic fibrosis. There is also a 50% chance that the child will inherit one mutated gene and be a carrier without showing symptoms. Lastly, there is a 25% chance that the child will inherit two normal genes, meaning they will neither have cystic fibrosis nor be a carrier. If only one parent has cystic fibrosis and the other is a carrier, there is a 50% chance the child will have cystic fibrosis, and a 50% chance the child will be a carrier without the disease. If only one parent is a carrier and the other is not, the child cannot have cystic fibrosis but has a 50% chance of being a carrier. From the perspective of living with cystic fibrosis, understanding these genetic risks is crucial. Cystic fibrosis is a recessive disease, meaning that parents who are carriers often show no symptoms themselves but can still pass the gene mutation to their children. If a child is born with cystic fibrosis, they will face a chronic multi-organ disease that affects the lungs, digestive system, and reproductive organs. This condition requires lifelong medical management, which can be demanding for both the child and the family. It's important to note that the risk of having a child with cystic fibrosis remains consistent with each pregnancy. Having one child with cystic fibrosis does not change the risk for subsequent children. Therefore, genetic counseling and carrier screening are vital steps for prospective parents who have cystic fibrosis or a family history of the disease. These processes help families understand their risks and explore their reproductive options. Advancements in cystic fibrosis care have significantly improved life expectancy and quality of life for those living with the condition. However, cystic fibrosis remains a serious illness that requires specialized care and attention. Understanding the risks associated with having a child with cystic fibrosis is essential for family planning and managing transitions related to pregnancy and fertility within the cystic fibrosis community.